1 hour for questions and answers afterwards. So Wolfgang, I'll give the floor to you then.
Thank you. Just a second. Can I now? How can I move the slides? Here. Okay, perfect. So yeah, I try to make it quick and give you an overview of the European Partnership for Personalized Medicine. Some of you might already know or have visited the webpage or are actually funded with the first JTC, which is called JTC 2024. So important is that we did publish together with EP PerMed and the International Consortium for Personalized Medicine, IC PerMed, did prepare a strategic research and innovation agenda. That one is actually the blueprint and the basis for a lot of activities we do in the partnership. Together with IC PerMed, we also dedicate some activities to the strategy and policy and the internationalization of personalized medicine as well. So, and there will be updates in 2027 and 2030. That seems to be a long time, but time is going very quick when you develop these kind of things. So that could be interesting for you as well. Okay, so the overarching vision of EP PerMed is that personalized medicine is to improve the health outcomes within sustainable healthcare systems through research, development, innovation, and implementation of personalized medicine approaches for the benefit of patients, citizens, and society. So that's the overarching. And now you maybe understand why it's very tricky and not easy to have only 10 minutes explaining EP PerMed and setting the stage. We already have now 61 partners. Most of them are funders and either regional or national ministries. They are from 28 countries, from 11 regions. We have a total budget of 375 million. That sounds a lot, but that's for a whole time period of 10 years. And from this budget, actually 275 million come from the partners, so from the national funders. And approximately 100 million is coming from the EU budget. We are dedicated to spend over 85% of the total budget to third parties, either coming from the research communities dedicated to personalized medicine or innovators and healthcare professionals and any kind of players who support us in implementing the developed personalized medicine approaches. We have a 7-year implementation phase, and then we have a 3-year transition phase, which will hopefully lead to a second version of EP PerMed or something different, but we really try to have a implementing something for the future, let's say it this way. So we have altogether 5 work packages. This is very brief. Joint alignment, development, and implementation of personalized medicine funding activities and research efforts are in general in work package 2. And the work package 2 lead is also available today, Monica Frenzel from France. Then we have work package 3, which is dedicated to support and accelerate PM innovations into either the market towards market access or implementation into the healthcare systems. Then we have promotion of PM implementation into the healthcare system, an extra dedicated work package, which is work package 4. Then we have international, national, and regional networking options to ensure personalized medicine development and implementation. For example, infrastructures, communication with medical societies, LZ topics, and scientific integrity aspects, and that's all activities within work package 5. And also, as I mentioned before, within work package 5, we are working jointly with the International Consortium for Personalized Medicine for international outreach and strategy and policy efforts for personalized medicine and related topics. So different PM-related mapping efforts, identification, dissemination of personalized medicine achievements and successes, as well as the engagement and education activities which we are planning and doing. So you see that the network support call is just one tool, one call out of a lot. So as I said in the beginning, have a look at the webpage for that. So to concentrate a bit more on the call type of activities, we have this kind of, we call it a readiness level circle. Most of you might know this from called technology readiness, but it's not only technology, it's also about other things which have to be developing. And there we have different types of calls. We have the, and I'm sure you know about that, the joint transnational calls. We had the first one in 24. The second one is under evaluation at the moment, which is called JTC25. We have the networking call, which is the reason for this event now. But we also have so-called research innovation technology calls. The first one will be published this year. Then we had already a first series of the so-called fast track calls and venture creating program, which is actually dedicated to the innovation steps of personalized medicine. So the venture creator is a kind of mentoring program for new startups. And the fast track is something which is trying to support the movement of a certain approach, personalized medicine approach, towards one or two readiness levels further. Then there will be more calls coming. I think the coming from the work package 4. So the education call is already open. You can have a look if you're interested. And there will be coming up so-called twinning calls. In simple, the idea is that when we have identified personalized medicine approach established in a certain setting, either in a hospital or in a regional or national healthcare system, then that is the donor. And then we try to find by matchmaking, or they try to find by matchmaking, one or more recipient, either hospitals, regions, or national healthcare systems. So the idea is that good PM practice is kind of transferred to other settings, and by that, the personalized medicine approaches are accelerated. So then I'm not going to explain this in detail because then I exceed my 10 minutes, but you see the network support call is part of the kind of research support activities. And then there's the other ones, some of them I've mentioned. Then we have all the activities dedicated to the innovation system, to the implementation system. We have a certain tools where we kind of support patient and citizen engagement. And we will have in our view for the next years also technology developments which can support personalized approaches, for example, artificial intelligence and machine learning and so on. So that is the general overview. The last slide is actually for giving you an appetite to have a visit at our webpage. But I think this hopefully puts the network support call in the perspective of the whole personalized medicine partnership. And I'm really hope that you all will be successful with your proposals, and that in the end, we can also disseminate the successes of this call. So I think that's it from my side. Thank you for your attention. Thank you for joining today. There's the centralized mail address. There's the webpage as well, and we are also in LinkedIn. And maybe what is also interesting in general for you now in this call, but also in general, that we have this PerMed database on the webpage where we have at the moment 138 consortia. So that's the ERA PerMed funded consortia and the first call of PerMed. So there are 750 partners in this database, and you can cross-check for funders, countries, topics, whatever. And there's more information on the webpage, and I'm sure you will get some questions. And if you have questions, you can directly contact PerMed at DLRDE or somebody you know who is involved in PerMed. So thank you very much, and have a nice meeting.
Thank you very much, Wolfgang. It's great having you here and sketching the bigger picture.
Okay, I don't know if you have time for questions, but I think the most interest is for the network support call, right?
Exactly.
Okay. Yeah, then I switch my camera off. Thank you.
Thank you. Well, now we start with the introduction of the network support call, and this will be followed by the question and answers. So these are the 6 items of the agenda of today, starting with the introduction and aims of the call. And this is one of the most important slides. So this is the participation in the call who are allowed to apply. Principal and co-applicants should be from the list that you see here on screen, which is also mentioned in the call text. Everybody that's applying as a principal or co-applicant needs to come from one of these countries. But be aware that the attendees to the meetings and the speakers are allowed from any country in the world. Here sketch an overview of the call procedure. And, there are different colors or different stakeholders per color. You as a potential applicant can now start building your network and prepare for the proposal and submit it to the PT outline submission system. Then me and my colleagues at the Joint Call Secretariat will do the eligibility check. We organize the evaluation of the proposals, including the ethical clearance. Then there will be a ranking list, and the highest ranked proposals will be selected for funding. Only those are asked to submit their proposals to the Zonneweeg system. So Zonneweeg is going to be the funder that is going to fund the selected proposals. You will get a grant decision from Zonneweeg on behalf of PerMed. And once that's done, the selected proposals can start their networking implementation, the event, followed by the scientific and financial reports. Then the Joint Call Secretariat will approve the reports, and we give a final payment on behalf of PerMed. This is the call calendar, which you all can see on the website. So the call was launched in the 15th May. Today is the information day. And deadline for submission of applications is on 29 September, Central European Summertime, 2 o'clock. We expect the funding decision notification in January next year, and the awarded projects have 1 year to conduct their networking event. It's a bit of a pity that this is placed over, but what I wanted to show here is that all the information is visible at the PerMed website. Here you see a print screen of the website when you click on funding and projects. Here you can see information about the networking support call. And over here you can see the project database, which is also very important for you, because here you can find your potential co-applicants or your potential partners in the event organization. And another important website, which is also mentioned in the call text itself, is the electronic submission system called PT Outline. Here's a picture of the part of the web page about the call text. You can see that you can download the call text, also the application form. Right side of the web page, you can see the changelog, which is empty by now, but it will be filled with the question and answers, the notes of it, today's meeting, and any other updates that may apply. The aims of the call is to bring together diverse stakeholders to tackle translational challenges in personalized medicine, thereby facilitating the acceleration of research findings into everyday clinical practice. Also to maximize the impact of prior investments in the framework of PerMed, prior ERANET, also the current PerMed European Partnership. These aims must be met by connecting researchers who represent a previously funded projects in ERA PerMed or previously or currently funded projects in EP PerMed to form a new consortium for enhanced networking and collaboration. And they should also engage with key transnational stakeholders who can bring expertise on advancing TM towards clinical implementation. Wolfgang mentioned the SRIA, the Strategic Research and Innovation Agenda, that's full of getting basic research into clinical practice. We hope with this instrument of the Networking Support Call, we can support this implementation towards clinical practice. The format of the event that you can organize, we provide financial support to organize just a single networking event. And you can choose between two formats, a face-to-face, in-person meeting, or a hybrid meeting where participants are present at a physical location, additional participants are present online. Important notes is that the total funding budget of the current call is 500,000 euros. It's all being done with EC budgets. And we also anticipate 2 additional calls in 2027, 2029, with the same amount of money. So in total, we have 5 million euros to organize 3 networking support calls. And the maximum budget for your application is 30,000 euros. For the consortia, have 1 year to organize the networking support event as a workshop or a conference with the focus on the translational aspects of PM research. And of course, networking events need to be collaborative, interdisciplinary, with cross-border participation. In addition, we also encourage the involvement of early career researchers, international cooperation, and the involvement of both clinical and pre-clinical groups. Expected outcome, impact. The outcome of the networks funded in the framework of the call should be enhanced collaboration in personalized medicine, enabling the implementation of research into healthcare. And the output must be at least be a report about the event, but it can also include publications or roadmaps, analysis, etc. Then moving to the eligibility criteria. This is unfortunate. The consortium must be of at least 3 applicants, 1 main principal applicant, 2 co-applicants, at least. The rest I already said, is that the networking event should be the expenses that are eligible, you can see over here. It's about hiring a venue, audiovisual equipment, catering, and such things. It's not meant to be for the hiring of staff. So you cannot do. It's not for the it's not for the salaries of scientific staff or student stipends. So focus on the principal applicants. Principal applicants should come from a legal entity that's established in a country in EP PerMed at the time of application. He or she should be a researcher that was involved in a project funded by ERA or EP PerMed. And must have an employment relationship with an organization that meets the EU state aid legislation. But in this way, we at Sonarway can ensure that we are able to finance you. Usually, this means that the principal applicant is employed at the university. The principal applicant cannot participate in more than 1 application to the principal applicant in this call. The co-applicants, so there should be at least 2 co-applicants, up to 7. 1 of these co-applicants must also be a researcher involved in another ERA or EP permit projects previously funded. So it should be at least 2 projects forming one networking event. And the maximum of 2 co-applicants can represent the same previously funded project. The other co-applicants can be researchers from a country participating in EP permits, involved in a national or international project related to health research towards personalized medicine. And co-applicant can also be a translational stakeholder, facilitating the transition from research results into implementation in daily clinical practice. We listed some of examples of that. It can be research nurse, healthcare provider, implementation specialist, health technology assessment expert, citizen or patient advocacy organization, regulator or policy maker, etc. Here I list the consortium composition. So on the top you can see the minimum consortium composition. So at least 3 countries should participate. At least 2 of them have to represent an ERA or EP permit project. The third one can choose whether or not it's represented EP or ERA permit project. 2 of them should be researcher. The other co-applicants can be other. Beneath you can see some examples of the consortium composition. Like for instance, in this case, none of the other co-applicants representing previously funded projects, or you have a mixture of more than 2 previously funded projects who are involved in this networking event. And for the information then, here you see a picture of the project database. If you click on the call text on the website, there's also a link to the project database. It looks like this. Here you can see the health categories, which are comparable to your own, and the research activities and all kinds of information, whether these projects are still active or closed or not. And on the website, there are also recommendations on the efficiently incorporation of patient engagement. The role of the principal applicant is to represent the network, both externally and to the call secretariat at Sonnenweg. That person should be the sole contact person on behalf of the network. And also that person will receive the funding on behalf of the network. The person should communicate all the relevant information to the call secretariat as well as the co-applicants. In the end, also submit the financial and scientific report to the networking event. The role of the co-applicants is to organize together with the main applicant a networking event. This can be in developing a scientific program or logistics, communication, or finances. Stakeholder analysis is also required. Maybe some of you have already taken a look at the application form. There it's stated that this must be done. The goal of this stakeholder analysis is to ensure that all relevant stakeholders are involved in the organization of the event or participate in the event. So the stakeholders may be involved as a co-applicant, but may also be involved as a speaker or participant in the networking event. Importantly, the number and type of stakeholders may be expanded in the course of organizing the event. So, for instance, if you realize that a certain stakeholder is needed, realize it after you've submitted your application, it's also possible to add that stakeholder to the meeting as a participant. And about of the submission, you see screenshots of the application form. It's quite small, but you can see, you can download it from the website. Here you see an example of the ethics self-assessment. That's part of the application form, the last part of the application form. Here it's blocked in red and green, whether you need to answer question. Question red, you don't need to answer. Question in green, you are asked to answer that. And on the website and also in the call text, there is a link to the EC guide, how to complete your ethics self-assessment. And please be aware that this ethics self-assessment is only about the data that you are sharing in the course of the event. So it's not about the ethics of your previous research in the project that was already funded. It's not about that, it's just about the event. So for instance, sharing data about participants, how you do that. This is one part of the proposal. The other part is the questions that are asked at the electronic submission system. Once you log in over there, you can see that they ask some additional questions. Both you need to answer, so the questions in the submission system and the questions in the application form. And the deadline, once again, is 29th of September. Once you register for the electronic proposal submission, you use the sign in button, and create an account. One account can be available per proposal. Principal applicant collects all the relevant information, fills up the forms, uploads the forms and the templates, and submits the proposal. So here you see a screenshot of the proposal submission system PT outline. I won't go through all the screens. The final part of my presentation are the evaluation criteria. There are three main evaluation criteria, which are common to also the joint national goals that we organize at EP PerMed. They are excellence, impact, quality, and efficiency of the implementation. All of these criteria have an equal weight. All of them are scored from 0 to 5. So 0 will be not appropriate, and 5 being excellent. And the maximal score to all of the criteria so can be 15 points. For each criterion, you have to have at least a score of 3 to be eligible for funding. The total score of all the criteria should be at least 10 to be eligible for funding. And based on all the applications, we have a ranking list, and the highest ranked proposals will be funded. Well, once your proposal is selected for funding, we ask you at Sonneway to download your application from the PT outline system and upload it to the electronic submission system of Sonneway. Because we will then have a grant relationship with you as a principal applicant. Sonneway will send a letter to the principal applicant containing grant decision, obligations, and applicable terms and conditions. And the principal applicant, once again, is accountable for the expenses of the networking event. And a bit about reporting. Of all the applicants, the principal applicants should submit an abstract of the networking event suitable for communication. Once the event is being done, we expect a scientific report, the outcomes, and a financial report. Then we already are ready for the question and answers session. If you have any question, you can put it on the general chat and we'll try to answer it right away. And if we don't have an answer at the spot, we will give an answer at the website. We'll make notes of this meeting, have a Q&A document on the website. Be aware if you have a question in the general chat, it will reveal your identity. Yeah, we can stop the recording.